Hello, in this video, I'm going to talk about the role of protein supplementation in strength training. So many people think we need to really increase the protein intake when we are strength training so that our muscles have the protein they need to recover and repair. That is true to some extent, but there is a limit. So it is not the case that the more protein, the better. There is a limit to how much protein the body actually needs and can use. And when we go above that limit, then we will convert that protein into glucose and fat. So it will have an increase on our blood, or it'll have an effect on our blood sugar, and it will cause us to store more fat because if we have more protein, carbs, or fat, then we will store those as fat if they're in excess of what we actually need. So regular strength training. So if somebody is engaging in a regular strength training program, so they're lifting several times a week ongoingly, then their need for protein will increase to 1.7 to 1.8 grams per kilogram of body weight per day. So you need to convert your weight, if you measure in pounds, you need to convert your weight into kilograms and then multiply by 1.7 to 1.8 to find your range for your protein needs per day. So supplementation or eating protein above that amount appears to have little to no advantage in terms of increasing muscle mass. And again, you will just store it as fat, which usually is not what the goal is, especially for somebody who is working out regularly. But the timing of protein intake can make a difference. So you want to make sure you're consuming enough protein in total and not too much. But you can also manipulate when you eat the protein and which amino acids you have so that you can use it the most effectively and take up those amino acids more effectively. So increased amino acid consumption after resistance exercise stimulates their net uptake, which increases net muscle protein balance. So what that means is if you have protein immediately following your strength training session, you are more likely to absorb and take up more of those amino acids and then use them to build new proteins in your muscle than when you have that protein at some other unrelated time during the day. So you obviously will have to have protein outside of just immediately following your workout, but having amino acids immediately after is going to be productive. Also, ingestion of carbohydrate and protein supplements, where you're having both together, that stimulates insulin secretion. The carbohydrate aspect stimulates more insulin, and that insulin is also going to help you take up more amino acids, and it appears to reduce catabolism, so breaking down of the tissues, and it enhances resynthesis of your glycogen stores that you probably used up during your workout. So those are some benefits, but it isn't clear if having a mix of carbohydrate and protein supplement before or after training. It's not clear if that has any bearing on hypertrophy or strength gains. So it's still good to avoid catabolism and to rebuild your glycogen stores, but you can't necessarily count on it contributing to greater hypertrophic effects or strength gains in response to your strength training session. In the elderly population, protein supplements seem to be especially important and especially effective at enhancing hypertrophic and strength-related responses. As long as they're working out 12 plus weeks, then those protein supplements seem to have a pretty significant effect. And it could be because they might not be getting enough protein in their normal diet. It's not clear on why exactly it has a better effect in the elderly than in everyone else. So creatine supplementation. So creatine is a popular supplement that you may have tried yourself. So I just want to talk a little bit about what it is, the effects it has, and why. So creatine is an amino acid that we get in the diet through seafood and red meat primarily, but it is found in other sources. In the body, it's stored as phosphocreatine in our muscles, and our muscles use the phosphocreatine in our energy production. So having more creatine will contribute to our energy use and efficiency in the muscles, which is why it helps with our having better workouts, basically. Like the way creatine works and is effective is because it improves your workout. And when you improve your workout, you get better adaptations from that workout. So it's been demonstrated to improve muscle power during exercise. It increases ability to do more work during training. So again, you get more energy in the cells that makes it so that you can perform more work. So more work in your training session is usually going to lead to better adaptation. So better strength gains, hypertrophy, or whatever it is that you're working towards. So it depends on your strength training, what your program is and what goals you're trying to achieve. But the creatine will give you more energy and make your workout better, so you're more likely to achieve those goals. Increase satellite cell activation. So satellite cells help your muscle fibers to repair and recover afterwards, and to recover after any kind of injury. So creatine will improve that process, and it also increases myonuclei concentration. So it increases how many nuclei you have in your muscle fibers. So it's not totally decided, it's not totally understood what the effect is that creatine has in the muscle cell physiologically, like what is actually happening. But it's probably a combination of a couple things. So like I mentioned, it gives you a better ability to store phosphocreatine in the muscle cells, which gives you a better capacity for using energy. But it also seems like it makes changes in the muscle fibers before the workout. It doesn't cause the muscle adaptations, but it's more like it optimizes the environment in the cells so that when you do your strength training workout, then the environment is more optimized so that you have better recovery and increased muscle mass in response to the training stimulus. Where people go wrong is they think that taking creatine is going to give them bigger muscles without the training stimulus, and that is not the case. It'll just make you retain more water and it'll just bloat your muscles, but it doesn't lead to any increase in muscle mass. It's the training stimulus, it's the resistance training that causes increase in muscle mass, that'll cause strength gains and hypertrophy. And the creatine can boost your ability to do that in response to training, but taking creatine without putting in the work in the gym is not going to have the desired effect. All right, thank you so much for watching. Have a great day.